I just want to give people encouragement around that attitude of continuing to be curious and to celebrate when you get some improvement in some way and to use that energy to keep going deeper and keep looking for more answers. That's definitely an attitude towards healing and towards finding a newness, a new normal that will carry you really far to keep up that curiosity, keep going into the depths that sometimes
Mm-hmm.
go with something like endometriosis.
What's up, ladies? Welcome to the Health Class She Deserves, the show where we ditch outdated women's health myths and talk real bodies, real cycles, and real stories. I am your host, Autumn Paone, and today we are speaking with Dr. Jen Mann. Dr. Jen Mann, ND, is the lead naturopathic doctor at Nova Wellness, a naturopathic medical practice located in the San Francisco Bay Area. Dr. Mann has worked in both conventional and integrative medicine over the past 15 years, including at One Medical Group, and has supported thousands of clients while they heal from chronic conditions. Nova Wellness was founded out of her passion for integrative medicine and a holistic approach to healing. She specializes in conditions such as autoimmune diseases, digestive disorders, and thyroid conditions. Dr. Jen, welcome to class.
Thanks for having me, Autumn. Glad to be here.
And we are glad to have you here. So I'd love to start at the beginning. Your business, Nova Wellness, was largely born from your own health struggles. Can you talk to us about how you ended up where you are now?
Sure. Yeah. I faced multiple difficult health conditions, an autoimmune thyroid condition, endometriosis. But the cool thing was when I was working on healing myself, I got diagnosed with my thyroid condition my first year of medical school. I was in a community of a lot of people. I was learning all about the bodies. I got this diagnosis, but I got to work on it within the context of learning and cooking classes and herbalism classes and getting this amazing education with incredible people. And so it was a very positive experience. And I really want other people to have that too, a place where they can go and learn and be with other people that want to heal too, and do that together with an element of community so that we're not all alone in our health struggle.
Yeah, and that's amazing because I think a lot of people, well, women specifically, we get these diagnoses for chronic conditions, and it's a lot of times like, what now? And there's not a lot, at least in the Western medical model, that is offered to us, in terms of healing or just symptom management, et cetera. A lot of times it's just birth control, and not everyone wants to do that. So I guess did that, like being in that situation, did that help you uh, kind of with that aspect of like you have some actionable steps to take through the herbalism and all that stuff? Or were you also kind of like, what do I do now?
It's a bit of both.
Yeah.
It's, I think, I had been through conventional medicine a lot in my whole journey. I remember going to a gynecologist in my early 20s because when I would do long runs, I would sometimes double over in pain and not be able to like have to stop my run and not be able to go anywhere. And I couldn't figure out like what the episodes were about. I went to my gynecologist and he didn't do an exam. He didn't do an ultrasound, nothing. He just said, this pain is as common as water. And this is basically what you have to live with. And I was like, wow, I'm like, if all women are experiencing this level of pain, like there's something really wrong. And, so I both normalized it and said like, okay, I guess this is how I have to live. But there was always something kind of lingering in my mind is like, there must be more. There must be another way to approach this, heal this. And I think, like most of us, there was a lot of trial and error going to conventional medicine, trying dietary things on my own. Through my medical education, I mean, I had a lot more directed information about what to do, exactly how to change my diet, exactly what herbs to take, what lifestyle changes to make. But even within there, um, there's this getting to know your body, getting to know how you respond. I mean, there's layers to go through. I recommend working with a mentor who can guide you through it much faster. I mean, it took me 20 years to figure out on my own, but with mentorship, you can move through the process. The right mentor, you can move through a lot faster.
Hmm. And I think that's such a common experience for women with, like, just this over normalization of pain, which is so crazy to me because it's like pain is never ever normal. Like, the purpose of pain is to be like, "Hey, something's wrong here. Something needs healing. Something needs fixing." It's not something that we should be telling 50% of the population that they're just destined to live with. That's crazy. But we've
Yeah.
normalized that so much. And it, it leads to situations like that and doctors like that, where it's like, that's what they were taught in medical school even, which is a scarier thought. So I think a
Yeah.
lot of people can, yeah, a lot of people can resonate with that as well. I would love to talk about, for listeners who maybe aren't sure, because you're a naturopathic doctor, what exactly is naturopathic medicine, and how does it differ from the typical Western model?
Mhm. So I was personally always interested in medicine. I thought it was fascinating. I loved the process of healing always. And in my early 20s, mid 20s, I was looking around at how did I want to practice medicine? Did I want to go through conventional medical school? Did I want to do something alternative? And a friend of mine invited me to go visit a naturopathic medical school. And I sat in on a lecture there about what is naturopathic medicine. And I just fell in love with the medicine. The principles of naturopathic medicine are that the doctor is a teacher, that our bodies can heal themselves, that there is a knowing within the body of that it can heal. It's a belief in using lower interventions before higher interventions. So things like lifestyle before using something like surgery. And it's based in how we practice medicine in Europe before things became so medication focused. And so, in a way, it's really the lineage of our medicine, but earlier on. So, as we go through getting trained, we get trained in all the conventional medical arenas to be a primary care doctor. We're also getting training in the body wants to heal itself. These are lifestyle techniques you can use, these are herbalism techniques you can use, supplements. It's a very full education and it's a belief inherently in health that we can create health, which is missing from conventional medicine. It's really about managing illness with medications or diagnosing things with certain therapeutic diagnostics like imaging or certain blood work. But it really doesn't hold that belief that the body knows how to heal itself. So I love naturopathic medicine. I love that inherent belief in the power of the body and, all naturopaths kind of practice a bit differently, but I think we're all holding that idea. We're all very education based, very empowerment based. And like in California, where I practice, I can practice like a primary care doctor. So I can prescribe medication if I need to. I can do physical exams, but we're doing more of the medication management in more extreme circumstances. The foundation is really on empowerment and these other therapeutics.
And thank you for clarifying that, 'cause I think that's a really big misconception with people when they hear naturopathic doctor. Like, it's a doctorate degree. Like, you're going through all that medical training. It's a lot more comprehensive than your typical Western doctor. And I think that's a really important clarification for people, especially in the age of the internet. And, like, we do have influencers who aren't qualified to be giving medical advice, who give medical advice. And, like, that's a whole other problem. But I think that in some people's minds, all of the, like, holistic stuff gets grouped together, um, and, that it's just, like, not the case. It's a very extensive, education and more extensive than what we've been taught is just, like, the normal doctor, right? So I said the word holistic. Can you talk about, like, what a holistic approach to you actually means? Because I think it's a big buzzword these days, and, yeah, not everyone really truly understands, like, what true holism is.
So, in the case of endometriosis, when you go to a gynecologist and maybe get a diagnosis, or maybe you spent many years trying to get a diagnosis, really, like you were saying in the beginning, the therapeutics you're going to be offered are things like birth control, hormone management, or surgery. And that's we've become very specialized in conventional medicine, where a gynecologist is just going to look at those organs and just look at that area and just think about hormones. In any form of holistic medicine, and there's many forms all over the world of different types of holistic medicine, we're looking more broadly at the whole person. So we're not just looking at the reproductive organs, with endometriosis, we're looking at the whole terrain of the system, the whole terrain of you as a human, you as a body, you as a spirit, your emotions, all these different layers we have to us as humans, and looking at where is there imbalances in the system as a whole. So yes, we know that with endometriosis, there's an imbalance in hormones, there's an imbalance in the pelvic area. But is that coming from the immune system? Is that coming from stress? Is that coming from something genetic? Is that coming from something spiritual? Where are the imbalances in the system as a whole? And really taking all of that into account when you're working with someone. And I think with that, you're able to get much deeper results, much longer lasting results, deeper transformation on a personal level that can lead to longer lasting results. I think people generally feel more seen in that too,
Mhm.
and body part. You're not just something to diagnose. You're a human being going through a human experience that's experiencing um, imbalances and things that need attention. That's a very different frame to look at your health through.
Definitely. And being so involved in the endometriosis space myself, it's like it's a systemic disease. So why wouldn't you be looking at the entire body as a system? Because that's one of like the main hurdles that we face with endometriosis is a lot of people and medical professionals also still view it as this like gynecological disease or a womb disease. And we know that that's not true. It's been found on every major organ in the body. It's very complex. And like you said, approaching it from this like full system, holistic place is going to yield much better results than just looking at the uterus. Because in reality, yeah, it can grow in the uterus, but that doesn't make it a uterus disease, right? I would love to talk about like with your endometriosis journey. Was there a turning point for you where you were like, my God, like something is healing, something is fixing, my symptoms are improving a lot? Or was it like this real gradual journey?
Well, I had worked on my health a lot up to the point of getting diagnosed with endometriosis. I had been through naturopathic medical school. I'd been implementing the lifestyle, but I was still having really painful pelvic episodes. And really, a huge piece for me was just getting diagnosed. And I'm sure a lot of people can relate to that. I had worked on my gut. I had excused a lot of it as other issues going on. I thought it was my gut. I thought it was chronic fatigue. I thought it was related to all these other things. I had kind of written it off just like that doctor had told me to do.
Yeah.
And so a huge piece was just getting diagnosed and knowing what was going on. These episodes I was having, the fatigue I was having, a lot of it was related to the endo. Once I knew what it was, then I could be like, well, what's causing this? Where is this all coming from? And it wasn't an immediate healing. Like you were saying, endo is a pretty complicated condition. And it's really, I think of it as more of a disease of the immune system,
Mhm.
ability to clear things out that it should be able to be clearing out. And the immune system is very complicated. So it took, once I knew what it was, I could be more directive in my care, but it did come off in layers, which is the case I see with most of my clients. It's not like you take the supplement and then it's gone, or you try going gluten-free and it's gone.
Mhm.
That would be very, very, very rare. It's
Mhm.
really about going through all the different root causes, balancing out hormones, working on stress, working on maybe even the structure of the pelvis, working on nutrition, removing toxins. There's lots of elements to working on endometriosis in a more holistic way. And so I just want to put that out there too. If someone's listening and you're like, hey, I tried that, it didn't work. It's very different from conventional medicine. You can't just take one pill or one supplement and resolve it.
Mhm.
It's really about creating a new body where this illness doesn't exist.
I think that is definitely relatable what you said about the diagnosis, especially like just getting that in itself is a big healing aspect where you're like, oh, wait, it's not normal. There is an explanation here for my pain. And, approaching it from all of these different like you said, like I'm in pelvic floor therapy right now and like the structure of the pelvis and like, getting your body mechanically working better can also help a lot. It helps so I think that's a really great message for the listeners, especially those who either recently gotten diagnosed or are in the process of trying to get a diagnosis that, like, one, it's not normal, and two, there are a lot of options available for you moving forward.
And one more thing on the autumn too is that when we say holistic, it doesn't mean you can't use conventional medicine too.
Mhm,
So I think there can be pressure sometimes or feeling like holistic means I can only take supplements and change my diet and everything should heal. And we can put a pressure on ourselves in that way. But you can do combination therapies. You can take hormones, you can get surgery, and you can use holistic medicine. And I think
mhm,
that's even more holistic, when we're
mhm,
all the tools available and not just putting our mindset as we have to use one thing or the other,
mhm,
vilifying the other. So for myself, right, I used hormone therapy when it was appropriate. I had surgery and I used more holistic naturopathic medicine, and they can work in combination really well together.
yeah. Yeah, and I love that you clarified that because I think it also goes back to what we were talking about with your training as a naturopathic doctor, is that's like true holism because it's in the word whole. So you can use I also have gotten surgery and I'm so incredibly grateful that I had access to that. But also at the same time, I am, working on tweaking my diet and, figuring out what is actually moving the needle for me, in terms of managing the disease and managing the symptoms. Do you have any, tips on because everyone is so different, right? Like I've heard this works for some people and it doesn't work for others, and there's the spectrum of symptoms on it for endometriosis is enormous, which also contributes to how horribly underdiagnosed it is. So do you have any tips, I'm curious, on really tuning into what your body needs? Does that make sense?
Yeah, I think there's a couple pieces to that. The first piece is that tuning into yourself and knowing what signals your body gives you when it's out of balance. So everyone needs to learn the language of their body. Your body can't speak to you in words. And so it speaks to you through different symptoms. Maybe it's brain fog, fatigue, pain, cramping, digestive issues, migraines, combinations of those things. And that's your body's language. You may also have a deeper intuition that's important to tap into too. But really, when your body is in balance, it will give you signals of feeling well and in balance and maybe an intuition that you're on the right track. When it's off balance, it'll give you messages of when it's off balance. So tuning into just your own body's language, knowing how it speaks to you. This is not an easy thing. This is an ongoing thing. You can use practices like yoga, meditation, mindfulness to just drop into your body and start to listen to it. That's a really important first step because when you're in pain, a lot of us have learned to ignore our bodies or feel like our body is the enemy. So, just repairing that relationship and that conversation with your body is really important. I think there's also pieces that are really hard to get to on our own. Again, finding mentorship can really be helpful in going through a process of discovering what is it for you that's activating your system? What's creating this endometriosis in your body? So when we start working with people, we use like an elimination diet. And we'll go through and take out major food intolerances and processed foods and things like that for a couple of weeks. And then have you start to add in different types of foods one by one. And with that connection with your body, start to hear how things affect you and what affects you in what way. And we do that process to work on nutrition, but it's also a process of reconnecting with yourself and the language of your body. And then there's things like labs that can give you information too. It can be hard sometimes to just hear from your own body. So labs are another tool to start to tap into like, what does my body need? Where are things off balance? Where can I give it more support? And so there's lots of tools to begin to tap in and follow this healing path.
Mhm. I would love to circle back to before when you mentioned that endometriosis is more of an immune system dysregulation or disease as opposed to anything else. Can you dive into that more? Because I think there's a lot of debate right now with how exactly to classify endometriosis.
Yeah, it doesn't really fall in any sort of real category. I mean, it's
Mhm,
gynecological because that's where it's mainly located in the body, but like you were saying, it can be located anywhere in the body. So, what I think about with endometriosis is why is this tissue growing in places it shouldn't be growing in? And so, to me, that comes down to more of an immune system issue of not clearing out tissue that's in the wrong place, that's growing uncontrolled in the wrong place. There's also theories that there's a genetic component or there was difficulty with kind of cell differentiation and things when developing in the uterus when you were just a fetus. But I think that to me, that's a question I hold with my clients and with myself with endometriosis is why isn't my body clearing this?
mhm,
And the immune system is very complicated. The immune system is made up of nutrient levels. So having enough things like vitamin D and iron. 80% of your immune system exists in your gut. So if your gut is off, your microbiome is off, your immune system's going to be off. It's related to blood sugar, to toxin exposure, to hormone imbalances. The tissue of endometriosis has hormone imbalances within it. But I think holding it as the immune system being off and not clearing it gives a broader arena to work in than just thinking about it as like a hormonal problem and like a gynecological issue.
mhm. And I think a lot of times because it's a disease that, 99.99% of patients are women or people assigned female at birth. And so immediately as a culture, we're all like, it must be hormonal because we just associate women with hormones as if men don't also have hormones. And, that's a whole other crazy conversation. But I think that with endometriosis, that's something that I kind of had to like reckon with before I got the official diagnosis, but I suspected it. But I also was like, maybe I just have like, a hormone imbalance. And I was doing all of these things and investing in high quality supplements and really paying attention to my body and trying to balance my hormones. And there were certain symptoms that I noticed major improvements with. And now, like in hindsight, I'm like, okay, those are the symptoms that were probably associated with just hormone imbalances. There were other symptoms like the pain and the nausea and things like that that just got worse over time, no matter what I did. And that was really my main, uh, like piece of evidence to be like, okay, there's obviously something more going on here. I also think it's interesting what you say about, why are some is my body not clearing this when other people's can? But what really truly is this disease? And we just have lacked so much funding and care at this upper level for so long that we're decades behind.
Just what I love what you said, Autumn, about how you were exploring this within yourself. It's like, oh, I did that layer and that helped these symptoms, but then this was still there. And then
Mhm,
you went deeper and you're like, okay, what else do I need to do to support my body? And I think when we broaden the lens of looking at like, oh, maybe it's more about the immune system and the immune system's even connected to our psychology and our environment. And it, that I just want to give people encouragement around that attitude of continuing to be curious,
mhm,
you need to go deeper and to celebrate when you do clear a layer or you get some improvement in some way and to use that energy to keep going deeper and keep looking for more answers. That's definitely an attitude towards healing and towards finding a newness, a new normal that will carry you really far to keep up that curiosity, keep going into the depths that sometimes
mhm.
go with something like endometriosis.
Yeah, I love that, and that's always my main piece of advice for people who, are in the process, like, pre-diagnosis especially, where I'm always like, the number one thing that you can do is observe. Like, track your symptoms in whatever way works for you, but be meticulous about it and really dive into, like, what is making your symptoms better, what's making them worse, and go beyond just, like, your food or exercise. Like, how were you feeling that day? Were you extremely stressed for something? Are you having relationship troubles? Like, what else is factoring into all of this? Because the more data you can have on yourself, the more effective you are when advocating for yourself. And, unfortunately, that's something we always have to be doing as women in the healthcare system. And we don't have really solid research and like clinical data for a lot of women's health issues. And so having all of that on yourself, like you said, is an attitude towards healing. Become a scientist and like your own case study, right? Um, I also
Learn
would
what
love.
it is for you. I mean, I can
Yeah.
sit here and say like, okay, this is about the immune system.
Hmm.
That's true. And for someone that might mean something else.
Hmm.
Could be about
Yeah.
something else. So you get to decide for you what it is and what it means and how you want to be in relationship with it. And I will say these skills you learn and how you heal yourself are incredible skills you get to use for the rest of your life.
Hmm.
I wish everyone knew the power of being able to heal yourself. It
Yeah.
is such a powerful experience to do that. It will carry you forward in so many different areas of your life moving forward. So there can also be gifts in the journey of exploring what this is for you and a transformation and skills that come out of it that will help you in the
Hmm.
rest in all.
Yeah, absolutely. And I love what you said before about the creation of health. Because a few months ago, I did an interview with a acupuncturist and Chinese medicine practitioner, and she brought up the term salutogenesis of like the creation of health in our bodies. Yeah. So yeah, it was like a new word I learned that day. I was like, that's fantastic.
Sure.
Yeah. So I think that's an incredible perspective and it's empowering, right? It gives us back some control, puts us in the driver's seat of my body can create its own health. I just have to figure out what is out of balance right now, what needs more support. And then I can, you know, allow for this salutogenesis to happen to kind of clear the pathway for that and to live a much more fulfilling life. I think that's ultimately what it comes down to is you want that fulfilling life because it'll help your pain and like these more physical symptoms, but also your mental health is going to naturally improve from that. Your creativity is going to bloom. Like there's so many other benefits that come from this perspective of healing, right? And I think this is a great segue into the intuition side of things and nervous system regulation, because that's something else that you emphasize, right? Like really helping clients understand their intuition and to really trust their gut. Can you expand on that a little bit more? And especially in the context of endometriosis, when so many women deal with the medical gaslighting and even gaslighting themselves. Can you touch on the importance of trusting your intuition and how you guide clients to do that?
Hmm. So when I was going through my own health journey, there was always something in me that knew there was something more for me. I always had this instinct or this knowing that I didn't have to live this way. I didn't have to live with chronic fatigue, with chronic pain, eczema all over my body, with gut issues, with painful periods. There was something in me that knew there was something more. And that was really what I call like my inner healer that was with me all the time, that was directing me and guiding me. And it was my inner healer. It was also my inherent health that was really fueling this journey. So when I was told, oh, it's just depression, take this antidepressant. Oh, you just have to live with this pain. It's normal. There was always something in me that knew there was something more possible. So finding that energy within you, learning to have a relationship with that voice and letting that guide you too is really useful so that you're not just like, oh, this Instagram person said this thing or this podcast person said this thing. Weigh that against your own knowing because in the end we are our own healers. We do have this built into our system, this kind of direction or a North Star maybe. So I work with people to, whenever I'm in conversation at our appointments, I'm always like, okay, tell me what's happening for you. What's your sense? And we're really having a conversation about the direction to go in. Of course, I have my clinical experience and education, but in the end, you have your body and your knowing. So that type of collaboration with a practitioner, whether it's with your surgeon, whether it's with a more holistic practitioner, even if it's with a friend or someone going through it too, always weighing what's coming in against that intuitive sense and building that intuitive sense is really powerful.
Hmm. Definitely. I think that I'm trying to think of how to phrase this question. As somebody who struggles with anxiety, and I just know that we're all very dysregulated, all of our nervous systems are a little haywire these days. Do you have any advice on how exactly to discern my gut feelings, my intuition versus my anxiety catastrophizing?
hmm I personally find it comes from a different place within me. So I can tell when my mind is running versus where there's something like deep in my gut and kind of deep down that it has a knowing. So this might show up different for person to person, but I think this is where things like meditation come in, where you can learn to quiet the mind, doing just mindfulness activities like body scans, doing things like yoga, getting out into nature, where we can start to quiet the mind, where we can take time away from technology and all the information coming in, where we can tap into that more. So, I take time every day. I encourage my clients every day to take time to meditate, get out into nature, quiet things down because we have so much information coming in. There's so much nervous system dysregulation. It can be hard to discern. And sometimes you just have to test it. You just say, oh, is this my anxiety? Is this coming from that place? Or is this coming from a deeper knowing? And test it. Try things out that your mind tells you to do, or maybe this deeper knowing tells you to do, and see where that takes you. It's really a grand experiment in being human. And,
Hmm.
we're not perfect, but like, luckily, I find life is very forgiving.
Yeah.
I can try things out and that wasn't the right direction. Okay, I'm going to come back. I'm going to kind of reassess. I'm going to go back out again. And there are lots of tools to build the intuition too.
I love what you said about like life being forgiving because I think that is what a lot of us are like. There's just, we put such high stakes on everything. It's like, well, no, I can't mess this up because it'll derail my entire life. And it's like, there's literally nothing's going to derail your entire life if you don't let it. Right. And so I think we put all of this like crazy weight on each and every decision that makes it way more stressful. But I love what you're saying of just kind of test it out, play around with it, be childlike and bringing it back to that curiosity you were talking about in the beginning of the interview of be curious about everything, and ask why, and collect that data. I mean, I'm a fairly type A person, so I really like having all of my like things tracked and physically written down somewhere. And if that's not you, that's fine. But I really find that helpful in seeing trends and seeing my growth, I guess, really kind of laying that out. So I think that's great advice. And you mentioned, there's a lot of tools when it comes to strengthening our intuition. Obviously, like meditation is one. I also am a very big fan of EFT tapping. I don't know if you've ever tried that. Yeah, I think that's been very useful for me. Do you have any other tips and tricks that you use with clients or like specific types of meditations? I know that there's a lot of different ones, and a lot of times people just try one version of meditation and then, decide that they don't like it. And so, do you have any other advice on that aspect of actual tools to use?
Yeah, so we do some of this in our clinic, but a lot of times the other person I refer to is like a somatic therapist
Mhm.
and doing psychotherapy, but with a somatic lens where you have someone to guide you into talking to your body. And you can learn all sorts of things from talking to your body, literally sometimes. I remember after I had surgery and I was still having a lot of pain even after surgery, and I was trying to decide whether to go on hormonal therapy. And I just did this like journaling with my uterus and my pelvis. And I was kind of like, these are the options. What do you think we should do? And with my non dominant hand, my uterus was like, I need a break. Let's go on hormones. I just like listened to what it needed. And I was like, okay, let's do that for a time. So somatic therapists can really use these tools to help you sometimes literally talk to your body and hear what
Mhm.
they say. I think that's another really cool tool and inquiry to think
Yeah,
about.
that's really cool. And that also, ties into like we were saying before with true holism being this all of these different modalities. Like we can use Western medicine while also supporting our body and healing our body with more ancient modalities and that internal wisdom. So that's a really cool story, like with your non-dominant hand. And yeah, this has been a very incredible interview. I think a lot of people are going to learn so much from this, especially I know I have a lot of endo girlies that listen, from my social media and stuff. And so I'm very excited for them to hear all of these different things. I do have one last question that I like to ask all of my guests. If you could rewrite the health class curriculum that every woman deserves, what would your first lesson be?
I really think building your relationship with your body and not treating it as an enemy is like the foundation for the whole healing experience. Like to cooperate, to listen, to work with versus against. That sets the foundation for all of it. Whether you're doing nutrition work, taking supplements, getting body work, acupuncture, if you can build that level of relationship with your body, you're going to go so much further.
Definitely. And I think, sadly, it's almost the opposite that we're taught in school. We're taught to fear our body and to fear our cycles, especially. And we're not even taught about the whole cycle. We're just taught about menstruation and that it's shameful or gross or painful. And uh, that I think also can lead to a lot of stored emotion in those areas that make conditions such as endometriosis or PCOS or anything else so much worse because there's all this shame around it, right? So I think that would be such a phenomenal lesson that if we just taught young girls, like, hey, you can trust your body and you can use XYZ tools to continue building your relationship with it. And the better you know yourself, the better your life will be. I think that would be a phenomenal lesson. Yeah.
Yes, and your body is so beautiful and it does all
Mhm.
these amazing things and it creates life and it's incredible what our human body does.
It really is. It's just the more every like new piece of information I learn, honestly, about women's bodies in particular is just fascinating to me. It's like I don't understand how we don't like worship at women's feet because they are just like we're so cool and we're so like biochemically efficient and powerful. Like it's just it's it's really amazing. So thank you so much for being here and for helping us get the word out about how amazing women's bodies are. Where else can people find you?
Yeah, you can, if you're in California and you wanted to talk one on one, we do offer discovery calls. You can book one of those through our website, www.novawellnessmed.com. And we'd be happy to talk to you. We have some blogs there and social media too, if you're not in California, but just want to stay in touch as well.
Awesome. And I will make sure that is linked for everybody in the show notes. Thank you so much, Dr. Jen. And thank you guys for listening. Make sure that you rate and review to help me out. Share this episode with a friend or anyone you know who has or suspects endometriosis. I think that they will get a lot out of it. And class dismissed.